Possible extremes out there for so many Americans fighting the flu, what the CDC is now calling an epidemic. The flu is now spread to 47 states, and this evening in some parts of the country, pharmacists still with the vaccine are turning some patients away, saving it for the most vulnerable because so many people are coming in to get it. Here's ABC's John Triffin now.
Tonight, many around the country are desperately seeking for what seems like a golden ticket, the flu vaccine. Doctors' offices and pharmacies filled with patients hoping they're in luck.
I was here yesterday and a gentleman came in and there was only one left, and I actually looked at him and he was a senior citizen, and I thought, shouldn't he have it more than me?
In New York, the governor has now declared a public health emergency which temporarily allows pharmacists to administer flu vaccinations to patients between 6 months and 18 years old. But is there enough to go around?
My name is John Triffin. I'm calling from ABC News.
We reached out to a popular pharmacy chain here in New York City and got this response.
Currently, we only have the flu shot for the elderly, the ones that are 65 and up.
That pharmacy's parent company, Walgreens, says select locations around the country may experience shortages, but they are quickly working to restock every store. CVS dealing with the same shortage issues at some of their stores.
Today we should be getting in possibly 30 doses in this location, but that could be gone in 20 minutes.
According to the Centers for Disease Control, the flu has now spread to 47 states. If your local pharmacy is out of the flu vaccine, head on over to flu.gov and they have a flu vaccine finder. Type in your zip code and it will tell you where to go.
If you do come into the pharmacy with flu-like symptoms, doctors say be careful not to double up on over-the-counter medications, which can be dangerous. Always check with your pharmacist first. David?
John, good to keep in mind. Thanks to you. I want to bring in Dr. Jennifer Ashton with our medical unit. Jen, always good to see you.
Good to see you.
You heard John report there, some pharmacists turning some patients away, saying 65 and older only. That's going to make people nervous out there.
Let's go through the numbers, David. There is still vaccine available. This year, there were 135 million doses actually made. About 128 million were shipped out or distributed. That's about 95% of the supply for this year. They are not making any more of this year's vaccine. Believe it or not, they've started to work on next year's. I ran out in my office on Tuesday. I called and I got a shipment on Thursday. You can still get it. You might have to go to a couple of pharmacies.
You might have to call around. It was a week ago you and I were talking about children. 2 more pediatric deaths this week. You were predicting that. But you've also learned of a shortage of medicine for children.
What we're seeing is a shortage in the antiviral medication Tamiflu in its liquid form, and that's the form given to children. This is due to a shipping delay from the manufacturer. The medication still can be made by the pharmacist. They're literally opening capsules and mixing it in a sweet liquid at the appropriate dose for children. But again, we're waiting for those shipments to reach the pharmacies.
And something you told us in the newsroom today that struck me is how long members of the family are contagious. Children are contagious longer than their parents.
Absolutely, and this is the thing about influenza, David. Adults and children can actually be contagious a day prior to the beginning of symptoms. Adults can infect others up to 5 days. Children even longer than that, in some cases more than a week. So if your kids are sick, keep them home.